It's the Back Road Song, Granger Smith this morning, 93.9 WLVB. Good morning. I'm Roland LaJoy. We have been, throughout the last couple of weeks, focusing on the month of May being the National Mental Health Awareness Month. And last couple of weeks, we've been chatting with the folks from Lamoille County Mental Health Services, which will continue next week. But also, the folks at the Lamoille Health Partners also have resources in which to help out. And we're with us this morning is Margaret Fondriest, who is a mental health counselor, and Matt Sadowsky, a clinical director and psychologist through Lamoille Health Partners. Good to have you both here this morning.
Great to be with you, Roland.
Thanks for having us on.
Yeah. So let's start with you, Margaret. Of course, the challenges of this last year, 15 months, has been pretty amazing, and I'm sure you folks have had to deal with many issues compounded by the COVID-19 pandemic.
It's true, Roland. I think that the word amazing hits it right on the head. I mean, it hasn't. There's no person it hasn't touched. Thus, pandemic,
yeah.
And it's sort of brought to light perhaps challenges people already had, put challenges on people that might not have had as many. So in terms of there being sort of one shared thing, it's the first time in a long while that's been the case.
And then the case for adults and of course young people too. Kids have also been impacted, and of course them having fewer experiences in life. This has probably been a big challenge for the kids as well.
Yeah, Roland, we have been seeing a tremendous amount of stress on kids and families. The school systems have certainly taken on so much and have done a wonderful job. The challenge there has been that some kids just aren't getting to school. And so we're looking forward to, this summer, this next year, when everyone's really hopefully back in school, able to come and access services. We're really encouraging people just to take care of themselves, and whether that means leaning on friends and families, whether that means getting some professional supports. In Vermont, we have, this entire pandemic, I felt so lucky as I walked out in the woods with my family and didn't have to worry about being around others and wearing masks. And I think we have, that's the wealth, or one of the wealths that we really have here in Vermont. And so part of that is just encouraging people to get outside, get there, doing some exercise. There's so many things that people can do on their own, and, just for people to know that we're there if they need that next level of help.
Yeah, of course, now that they're talking about, and of course it was in the news this morning, announced yesterday, that now more of the mask requirements are now starting to be eased a bit, though we'll see what Governor Scott says later on this morning during his press conference. But Margaret, there's such a stigma about when you talk about quote-unquote mental health issues that some folks might be just maybe a little bit, afraid to. Do I really have an issue? But there's nothing to be ashamed about to have problems, especially what we've been through for the last year or so.
Yeah, I mean, the way I think about it, Roland, is that mental health is really code for emotional health. When our emotions can be had and felt, then they pass. And then our mental is usually well, our thoughts and behaviors are all well, and thus we have what we call mental health. When our emotions, anything that's hard, get stuck, are too hard to feel, when there's not sufficient support to feel them, then they don't pass. And that's when the rest of our mental gets messy. That's now an oversimplified kind of way of thinking about it, but I like to keep things simple. I think that mental health treatment in and of itself could use a little demystifying. We don't sit on couches. Nobody's behind you taking notes anymore. Right. It's pretty much a conversation, sometimes about emotions, about feelings. That's where work around trauma starts to look like that. Sometimes it's about changing behaviors.
Yeah.
That's what a lot of substance use looks like.
Right.
Sometimes it's asking questions like, what do I want my life to look like? How do I make my life look the way I want it in the middle of a pandemic?
It's true.
Well, may I just add, it's been fascinating here. So as part of Lamoille Health Partners, we have Morrisville Family Medicine and Stowe Family Medicine and the pediatrics. And so we have behavioral health counseling supports within a lot of those primary care settings. And, I personally have been pulled in where there might be, a 60-year-old person who's never been to mental health and has never even thought that they would benefit, need, or would have any interest in it. And when their doc pulls me into the room, and for me to sit with someone for just like 20 minutes and just hear what's going on for them, and to just kind of, help them get pointed in a little bit of a different direction. It's been really profound to see people that really would never call to schedule an appointment say to me, wow, that was really helpful. Like, I would come back for more.
Yeah.
And that's the kind of work that we do. We're just trying to keep it real and support our community.
Yeah. It's in perception sometimes that people are that shy away from services, but they shouldn't, should they, Mary Margaret?
Well, I think we have these old ideas of what talking to a therapist looks like, or even more so, like what we're supposed to do with feelings. So buck up.
Yeah, exactly.
Have coffee, go to work. And we're beginning to kind of be more honest with ourselves that, especially when you look at, now, I'm not a data person, but we know that stress and heart disease, stress and high blood pressure, stress and alcohol use, we got to come up with more.
Yeah. So this pandemic has actually brought to light even the fact that there's nothing to be ashamed about to ask for help and ask for services. In closing, we only have about a minute left. So Matt, for folks who want to find out more about your services concerning mental health counseling, what's the best way for them to get started if they're listening, saying, yeah, maybe I could use some assistance? How do they go about starting?
Yeah, I think there's sort of two avenues. One would be just calling our number here at Behavioral Health and Wellness, and that's 888-8320. And we actually, Lamoille Health Partners, just put up a new website that has lots of information. It's really nice. We've had a pretty outdated site for quite a while, so I encourage people, LamoilleHealthPartners.org. And we've been posting videos, and it gets up onto our Facebook as well, just with, quick little videos that gives people some short help. The other way is that we're really encouraging people. A lot of people have dropped out of going to their doctors and dentists over the last year, and for people to go in and go see their provider, and they can actually help them get connected with mental health or substance use or psychiatric services as well.
Okay, perfect. Mary Margaret Fondriest and Matt Sadowsky from Lamoille Health Partners. Some great information from both of you. Thanks for sharing the time, and enjoy the sunshine this weekend. That's great therapy.
Oh, you too.
Yeah, thanks for having us.
Well, and have a great vacation.
Oh, boy, it's getting out now. Okay, well, great. Good. We'll talk to you soon. Have a great weekend.
You too.
Bye-bye.
Okay, bye. All right, that's Mary Margaret Fondriest and Matt Sadowsky at Lamoille Health Partners during Mental Health Awareness Month.